Thank you, Dr. Mazine. And I see a theme coming around, love. Okay. With that said, next we have Dr. Alan Greenberg, professor and chair of the Department of Epidemiology and Biostatistics at the George Washington University School of Public Health. He is an internationally renowned expert in the field of epidemiology and HIV. He is also the director of the NIH-funded DC Developmental Centers for AIDS Research and principal investigator of the DC cohort study. He brings greetings from the HIV research community in Washington, DC. Please welcome Dr. Greenberg.
Thank you so much. It's a genuine privilege to have the opportunity to speak to you this morning and to co-sponsor for several years in a row this very important event with Howard University and Dr. Rana and his team. So we'd like to thank you very much for this opportunity. My name is Alan Greenberg, as said. I direct the DC Developmental Center for AIDS Research, which represents now 188 faculty members from 6 institutions here in Washington, D.C., of which Howard University is a founding member. It also includes, right across the reservoir, Children's National Medical Center and the Veterans Affairs Medical Center, as well as American, Georgetown, and George Washington Universities. Dean Anthony Wuto, who's the Dean of the School of Pharmacology here at Howard University, is our institutional representative. He leads our activities at Howard University, and Dr. Rana is a proud member as well. And we're very happy to join hands with the love and the spirit that is brought into this conference today. We also have today in the audience, who's also on the organization committee, Marcia Ellis, who coordinates our community advisory board and is on the organization committee. Marcia, thank you for your leadership. We're grateful to you. We are a collaboration of scientists and investigators who represent the laboratories, the clinicians of Washington, D.C., who are in the clinics every day, and the nurses, and as well as the social and behavioral scientists. We're very proud that with the health leadership of community and the health department, there has been significant progress in fighting the AIDS epidemic in D.C., with a decreased number of cases over the last several years, but nevertheless, still over 2 new infections reported a day in our city. So there's a lot of work to be done, and we try to make our small contribution as researchers to those of the government and community and the universities here in this fight, and we're very, very proud to sponsor this event. So we wish you good work today, and thank you for allowing us the privilege, genuine privilege of working with you to put on this conference. So thank you very much.
Thank you, Dr. Greenberg. Now we have Dr. Sohail Rana, the conference director and professor of pediatrics and child health at Howard University. He will introduce our keynote speaker.
Wow, thank you, all of you being here. And thank you, Lisa. Thank you, Alan. And thank you, Raphael. Those are beautiful words. And Lisa, to warn you, I'm going to read this book to introduce Jeanne. Jeanne, did you finish this book? No. I'm not here to sell the book, but Patty gave this book to me as a gift. Who knows Elton John? Well, let's raise hand. Who doesn't know Elton John? Is there anybody here who doesn't know? Okay. I'm sure you have heard some of his songs, but may not recognize his name. But a little older than you, and so pardon us. So, but Elton John, he all through our life, he has entertained us, and just recently, last weekend, he was right here in Washington, D.C., and he's had many packed house concerts. And I just would quote, I will be quoting him a little bit. So, Elton, I hope I have your permission. Just to introduce briefly, Ryan White, 28 years ago, him and his family discovered what would change their lives forever. they found out that Ryan had HIV/AIDS. He was born with hemophilia that required regular transfusions, and it was through those transfusions that Ryan contracted HIV. This was early in the epidemic of HIV. There was absolute ignorance. I don't think we have changed much. There was absolute stupidity. I would argue we haven't changed much. And in fact, we're acting more stupid because we know a lot more, but many of our speakers will talk about that stupidity, so I'll hold my tongue. That's hard, right, Lisa? Now, Ryan's illness brought the worst out of many in the community, especially those in authority, those that are most important to a child, and that included the school system and the church he attended. Ryan became the ultimate face of the disease, and the suffering became a picture of prejudice every person with HIV faced at that time and continues to face in a modified way even today. And Elton, in his book, Love is the Cure, writes about Ryan's family and his mother, and these are his words, says, I fell in love with the whites right away. I fell in love with the whites right away. Despite all the suffering, Ryan remained upbeat. Jeanne do you pronounce your name Jeanne or Jeanne? Jeanne. I said it correctly first. Jeanne, who must have been going through the worst torture of her life that any parent could ever imagine, watching her child die a slow and painful death and not being able to do anything about it. But she never asked, why me? She embodied forgiveness and acceptance and perseverance at every turn. And according to Elton John, through his suffering and constant fight with HIV, Ryan became a modern-day Jesus and his mother a modern-day Mary. I paraphrased a little bit. Elton John credits his own healing. Elton was in bad shape. If you ever look at his songs from that time, Danielle, she watched their videos on YouTube, he looks like a mess. And he credits his own healing from the mess of drugs and other ailments. That healing occurred through his association with Jeanne and her family. Today, Jeanne continues to do the work that started almost 3 decades ago. She continues to raise awareness and fight stigma associated with HIV that persists despite decades of advances in treatment of HIV. So, Jeanne, I present you today before this wonderful crowd and the crowd around the world who are watching you as a true general for our soldiers, a true lighthouse in the ocean of ignorance and darkness, and a wonderful and outstanding human being. Please help me welcome Jeanne White Ginder.
So we can see you.
Elmo's going to help you if you have trouble. There's the guy over there who's going to manage this
Okay.
screen when
That's
you're ready.
No. Wow. Good morning, everybody. Thank you very much for having me. My name is Jeanne White Ginder, and I'm the mother of Ryan White. But I also have a beautiful daughter, Andrea, who was very much a part of the story. But a lot of the time, she was left out of the story. I'm just a mom. I'm a mom that because of a misunderstood disease called AIDS, my life changed overnight. It was not anything I thought I was going to have to even worry about or think about, but my son Ryan White was born with severe hemophilia, and he took a clotting agent called factor VIII, which contains the clotting agent found in blood,
And because of this, in 1984, my son was diagnosed with AIDS. He was one of the first hemophiliacs to come down with AIDS. And at that time, people thought you had to do something bad or wrong to get the disease, otherwise you didn't get it. People feared that kissing, tears, sweat, and saliva might spread AIDS. People would say, well, the whites have a dog. What about fleas? What about mosquitoes? We think AIDS might be transmitted that way. So people were very, very scared. And there wasn't a lot of information even in print on AIDS at that time. My son, Ryan White, was diagnosed with a T cell count of 25. It never got any higher than 25, but he lived 5.5 years. They had told me he would only live 3 to 6 months, but he was a fighter. He was a fighter that wanted to live. And when Ryan was first diagnosed, he had pneumonia in both lungs. He came home, how it all started was he came home from school one day, and he said, Mom, you got to do something. He said, I can't even get off the school bus without being tired. He said, we had to run a lap today at school, and the teacher got real upset because I couldn't finish. He said, Mom, I don't understand what's wrong with me. A few days later, the 103, 104 fever started. They put him in the hospital, and he was diagnosed with pneumonia in both lungs. They kept coming in and pounding on his chest and saying, Ryan, if you want to get better, you've got to cough that stuff up. And Ryan, just totally exhausted, said, Mom, why won't they listen? There's nothing down there to cough up. He was being treated for bacterial pneumonia, and he never got any better. Finally, they transferred him to Riley Hospital for Children. There in the emergency room, infectious disease doctor, Dr. Kleiman, met me. He said, we feel Ryan has TB, cancer, or possibly AIDS. They ruled out TB, and that left cancer or AIDS. I didn't know anything about AIDS, except that the only thing I'd seen on TV was people who had wasted it away. And they were just nothing but skin and bones. And I thought, well, my son can't have AIDS, but I didn't want him to have cancer either. And he said, we need to do a biopsy. There was no AIDS test at the time. I said, well, Ryan's a severe hemophiliac. He said, this child is getting worse. This child's going to die if we can't find out what's wrong with him. So as a mom, it was pure hell because of his hemophilia. I had to sign these papers that said that there was a good possibility he may not live through surgery, but he was going to die if he didn't get no help at all. I signed the papers. He got factor. They took him into surgery. They did a 2-inch biopsy. They sent the results to Denver, Colorado, where the results came back that he had pneumocystis, which said that he had AIDS. Dr. Kleiman told me he had AIDS, and I said, well, how long do you think he might have? And he said 3 to 6 months if we can get him over what he has now. I said, if this is so new, why couldn't you be wrong? I couldn't understand why you didn't hear of others. The CDC became very concerned about Ryan's case because for the treatment for hemophilia at one time was blood transfusions. Well, Ryan had never gotten blood transfusions, only the blood clotting product. So they had me fill out all these forms and forms. There's like 20-some pages, everything we do in our family. And I said, this is really scaring me. I said, we're a real affectionate family. I said, we hug, we kiss, we share drinks. And they assured me back in 1984 that no family member had ever come down with AIDS, so I had nothing to worry about. But I soon found out that hardly anybody knew anything about AIDS. All of a sudden, the gowns, gloves, and masks started appearing at the hospital. All these certain nurses was always taking care of Ryan because what had happened is they started educating the nurses and asked for volunteers to take care of Ryan. So it was very confusing, but not seeing everything at first. People say, why did you go public? Well, we didn't go public, but I really kind of didn't know not to either. I didn't think to lie to people. Two people from the church came down to see him, and they were praying over Ryan, and they asked me what was wrong, and I said, well, they say he has AIDS, but I think they're going to find out it's something else. Then he had 3 teachers that came down to visit him. They brought a lot of cards and letters from his classmates because they knew he'd been very, very ill. They asked me what was wrong, and I said, well, they say he has AIDS.